Welcome to the Plain English Public Health Weekly Report. I'm Richard Greenland, and today is April 17th, 2021. As always, we start with our COVID-19 statistics. Worldwide, we have over 141 million cases and over 3 million deaths. In the United States, we have over 32 million cases and over 580,000 deaths. The biggest news this week in public health is that the United States has paused use of the Johnson & Johnson vaccine against COVID-19. That's due to possible rare blood clotting. It's a lot like the AstraZeneca virus or vaccine. In fact, they use the same process, or at least a very similar process, to create it, using an inactivated adenovirus, which is different than a coronavirus, but has some of the same features. But they use that to get the vaccine into the body. So because of that, they think that may be contributing to that blood clotting. There's still very little evidence that it is actually being caused by the vaccines, but the evidence is increasing a little bit. Again, it's still very little evidence, but it does seem that there might possibly be a connection. Right now, they're basically just trying to play it safe. It's estimated that the pause in using the Johnson & Johnson vaccine will probably only last a week or two, maybe 3. The few studies that have been done, both on the Johnson & Johnson vaccine and the AstraZeneca vaccine, have shown that any connection that there is would be a very rare connection. So basically in the United States, for the Johnson & Johnson vaccine, there have been 6 reported cases of these severe blood clots out of over 7 million vaccines given. So that's a tiny percentage. It's extremely rare. But, of course, we want to play it safe. It's a new vaccine. We want to be sure it's okay. So, pausing this may actually do more harm than good. Just because fewer people will be able to get vaccines quickly without the extra amount coming from Johnson & Johnson. We'll have to rely just on the Pfizer and Moderna vaccines. But that's also why they're doing a short pause. They don't want to do a long pause. They just want to get a little extra time to understand better if there is a connection and what kind of a connection it is. So just a few things to note on this. Only the Johnson & Johnson and AstraZeneca vaccines have shown a possible connection with these blood clots. The Pfizer and Moderna ones have had 0 cases of these blood clots. So they definitely don't have any issues with that, no connection at all. All reported cases of those blood clots have happened, at least those that are possibly connected with vaccines, have happened within 2 weeks of getting the vaccine. Just to be cautious, experts say that it may be possible to have these blood clots show up 3 weeks after if there is a connection. But generally speaking, if you got the vaccine, the Johnson & Johnson vaccine, for example, more than 3 weeks ago, you're going to be fine. You're safe. If you got the Johnson & Johnson vaccine less than 3 weeks ago, chances are you're probably still going to be safe. I mean, there's a very, very rare chance that you'll even get this at all. But if it's been less than 3 weeks since you got the Johnson & Johnson vaccine, just keep an eye out for these symptoms. They include severe headaches, abdominal pain, leg pain, and shortness of breath. If you have any of those symptoms, and again, within 3 weeks of getting the Johnson & Johnson vaccine, please contact your doctor, just to be safe. Even with this side effect, though, remember, it's still currently safer to get any of the currently available vaccines than it is to not get them. So please get any of the currently available COVID-19 vaccines as soon as you're able to do so. Now that the COVID-19 vaccines have been rolled out to millions of people in the United States, we are starting to see some people getting COVID-19 even after being fully immunized. It's thankfully well within the normal effectiveness that we saw, in the trials before they were rolled out. So still, very few people are actually getting the virus after the vaccinations, but there are some. Also, we've even seen a few deaths from COVID-19 in fully immunized people. So it's not 100%, but it's such a low number compared to the number of vaccines given that it's virtually 100% effective against death. The actual calculation comes out to something like 99.9999%. So basically 100% effective at preventing death. So please, I can't say this enough, please get vaccinated against COVID-19 as soon as you are able to do so. New studies have shown that the B117 variant, the one that we originally saw in the UK, does not seem to be more deadly. Some previous studies said that it may be. The newest study says it's not. Of course, there still needs to be more research to kind of come to a consensus on that. But as of right now, the general consensus on this, after all the studies have come out so far, is that it's not more deadly, though there may be slightly more severe symptoms. And also, it's definitely more easily spread. Another thing that's been noticed is that the B117 variant seems to affect people under 50 a whole lot more than the previous strains did. And so just because you're not over 65 anymore doesn't mean that you're safe. Like we reported before, the B117 variant is now the dominant variant in the United States and in a number of other countries. So we do need to be careful of that, regardless of your age or overall health. In other news, a new study has shown that BPA and BPS, that's bisphenol A and bisphenol S, chemical additives found in many types of food packaging, even in plastic water bottles and things like that, those chemicals can cause permanent damage to the brain neurons. The study was done in fish, but the scientists say that the way the study was done, they expect it to be the same for humans also. Of course, more research is needed, but since the majority of items, food items that are found in those kind of packaging, the packaging that has those chemicals in it, are not that healthy to begin with, we should probably avoid them anyways, just for our health. So whether you're doing it for avoiding the BPA or the BPS, or you're avoiding the extra salt and sodium and everything else that's found in prepackaged processed foods, either way, just avoid them. They're not really healthy for you anyways. So thank you for watching the Plain English Public Health Weekly Report for April 17th, 2021. As always, we have links below the video for things that we weren't able to get to this week, and also for more information about things we did talk about. So please check those out. I'm Richard Greenland, and you have a healthy weekend.